Hi, this is Andy Schumann with another Tabletop Tech Review. Today we're going to discuss and take a look at the Exergen Temporal Scanner, the model TAT 5000 clinical thermometer. Back when I opened my first practice in 1986, I saw an advertisement in Contemporary Pediatrics that caught my attention, and I was the proud owner and early adopter of a first temp tympanic thermometer. This was a device that was manufactured by Intelligent Medical Systems and promised that the device's measurements were as accurate as oral and rectal temperatures taken with glass thermometers. I was skeptical, but within weeks it proved to be a very popular device in my practice. Exergen introduced the temporal artery scanner a number of years ago, and now it is the most used clinical thermometry device in clinical practice today. The device was invented by Francesco Pompei, the founder and chief executive officer of Exergen. He suspected that the superficial branch of the temporal artery was an ideal site for reliable and reproducible temperature measurements. So they introduced the TAT 5000, this thermometer, in 2000, and now, 17 years later, the company has sold more than 400,000 devices. This device measures the core body temperature, which is about 1 degree Fahrenheit or 0.5 degrees centigrade higher than oral readings. It uses dual scanners, one that measures ambient temperature and another that gauges the arterial temperature of the patient's skin. It records over 1,000 readings per second, producing an audible click as the device registers a higher reading. After taking 3,000 readings, an internal heat balance algorithm determines the arterial temperature. This is displayed on the unit's LED screen. One takes a temperature from the temporal artery and then places the thermometer behind the earlobe, and a temperature is displayed on the screen. The thermometer lists for about $400, but Exergen typically sells these devices on sale frequently for about $200. The device is incredibly popular in the medical community because it carries a lifetime warranty. What's interesting is that Exergen worked with a physician, a pediatrician, and 15 pediatric practices associated with the Children's Hospital Medical Center of Akron, Ohio, to establish a normal upper limit of measurements for its temporal artery thermometer, and the study involved 2,300 temperatures from children to determine the threshold of fever as displayed in the table. What's interesting is that we commonly use a threshold of 100.4 in babies 2 months and less, a critical temperature that would warrant a workup for sepsis. But according to this study, the threshold using this thermometer is 100.7 degrees Fahrenheit. So great thermometer, very durable. You clean it between uses with an alcohol wipe. If you experience low temps, as the label says, you clean the center lens every 2 weeks with a Q-tip and alcohol only. Never use bleach. Very inexpensive, lifetime warranty. Now they're coming out with a wireless model that will transmit temperatures to EHRs directly. So one of the best low investment, low cost devices you can acquire for your medical practice. This is Andy Schumann from Gizmos. Have a nice day.